My name is John Welling. I'm co-founder and CEO of Daybreak Vision Project, an organization that our mission is to bring sight-restoring cataract surgery to those in greatest need. This week we're here in Bolgatanga in Ghana's Upper East region doing a high-volume cataract outreach with our local partners from here in Bolgatanga at the Presbyterian Eye Clinic and also Komfo Noche Teaching Hospital from Kumasi. And we have a multinational group here this week working to bring sight-restoring cataract surgery to as many people as possible. Cataract is a blurring of the lens inside the eye. It happens naturally over time. And so people in their 60s, 70s, it's very common to go blind from cataracts. But even people in their teens, 20s, 30s, 40s, we've seen children this week as young as 8 years old. There are many people that are blind from cataract at all ages. And so our goal is to bring sight to these people who have been living in darkness. The rate of cataract blindness is very difficult to quantify, especially in more rural areas. In some places it's considered to be as high as 1, 2, 3%, but it's very difficult to measure. But here in Bolgatanga, we're expecting to do about 1,000 sight restoring surgeries this week. We were here a couple years ago, we were here a couple years before that, and so it's never a problem finding blind patients. There's so much blindness in the surrounding community. So cataract is primarily an age-related process, but it's also believed that ultraviolet exposure can also contribute, genetics, malnutrition. So there are many causes, but in a place like Bolgatanga where people are outdoors farming and spending a lot of time, the ultraviolet light very likely contributes to the rate of cataract. So unfortunately, there's not much that can be done to prevent cataract blindness other than being cautious to protect your eyes when you're working. Cataracts can also be caused by trauma, so just avoiding things that could injure the eye. But other than that, there's not much that can be done. The most important things that is happening this week is that we are providing training in high volume cataract outreach. So we train all of the doctors, the nurses, and the staff here at Bolgatanga. And we also have 2 residents from Komfo Noche Teaching Hospital who are in training. And so it's a very hands-on, intensive training experience where they're learning to do high volume, safe cataract surgery. And it will be something that they'll continue throughout their careers here in Ghana. And so training is really at the heart of sustainability and something that is very important.
In Ghana, currently we have about 40 residents. So these are doctors that are at various stages of specializing to become eye specialists. 10 years ago it was not the case. In a whole year you have 3 or even 2. But now the interest is growing with the support of a lot of NGOs like Daybreak. You find out that the interest is coming, and other NGOs, the interest is increasing, and we are hoping that very soon in the next 5 years we would have trained a lot of people to become very proficient and competent. There are certain countries like in the West where, because you have so many doctors and the needs are there, the distribution of ophthalmologists, eye specialists is there, is very good. You find out that access is easy. Here in Ghana, the access is not there. Of this number of specialists that can do this, you find out 70% are in Accra and about 20% are outside Accra, with 10% spread across the other regions that have it. So we are hoping that in the next 5 years, this will bridge this so that we have doctors spread evenly across the whole. When we look at in Ghana and across sub-Saharan Africa, in developing world, you find out cataract is the #1 cause of reversible blindness. And so everybody, once you are growing from a baby and growing up, will develop cataracts because you are changing, and there's a glass in the eye called the lens that also changes as you grow. So cataract is not a disease that people should be afraid of, that should be stigmatized. We should embrace it and know that at any point in time when our vision starts blurring, it is possible it's due to cataract. My advice to everybody listening is that eye diseases are real. There's cataract, there's glaucoma, there's diabetes eye disease that affects the eye. And so I'll say that gift yourself with an eye checkup once a year. Every year when it's your birthday and you are buying a cake or you are buying drinks and celebrating, think that it is at the end of the year, and so let me get an eye checkup. Let me get a general body checkup to make sure that I'm keeping the body healthy and still going strong. My appeal to the government is that there are so many NGOs like Daybreak in the country, in Ghana now, that are doing philanthropic work. Ideally, we are taking care of our people as Ghanaian eye ophthalmologists. We have support of these big organizations like Daybreak. One of the challenges that we have is that even getting free or subsidized imports, tax clearance waivers. We bring a lot of these equipment. As you see, everything that is being used here for the surgery, from the lenses to the equipment to all these complicated things, are all free. Okay, and so, but however, when these things are being brought to provide free surgeries for all patients, you find out that you have to pay high taxes at the ports, and these taxes are equal to what will be charged to people that will be bringing these things for private work or for profits. So Daybreak is a non-profit. I'll pledge or beseech the government to kindly consider having tax waivers for some of these things that come in to provide service. Daybreak is an NGO that is helping and augmenting the efforts of government, and we believe that we are partners, and so this should be carefully looked at.